Hello everyone. This video is about collection of blood samples, essential techniques for medical professionals. First of all, welcome to my channel eduhub.2m, which provides new educational videos on various aspects of hematology, physiology, nutrition and all. So something about collection of blood samples. Blood collection is a fundamental procedure in healthcare, providing crucial diagnostic information that guides patient treatment. So whenever there is a problem in our body, or if we face some problems, we go to the doctor for consultation, and doctor gives some blood test. And if we do not know how to collect the blood, basically this is for the BMLT students, from where the phlebotomist comes up. So if we don't know that how to collect the blood samples, then we are not be able to serve the patient. So let's dive into that. First of all, how we have to prepare for the blood collection. Before the collecting of the blood, proper preparation is essential to ensure accurate result and patient safety. So these two things should be maintained in the mind, that the result should be accurate and the patient should be safe. Number one, verify patient's identity using at least two identify name, date of birth and ID number. Means there will be lot of patients in a lab for blood sample. So everyone should be identified by the sample number or the name or the date of birth, which is different from patient to patient. The second point is obtain informed consent after explaining the procedure. So the procedure should be explained properly to the patient, that what is going to happen, how the blood is will be collected, and then the patient will sign a consent form that he or she know everything regarding the blood collection. The third and the most essential point is review patient history for factors that might affect the collection, like medications and fasting status. Next, assemble all necessary equipment based on required test. That means different type of blood test requires different type of vials which contain different type of anticoagulants. These all should be checked before the collection of blood. Maintain aseptic technique throughout the procedure. That means the collector or the phlebotomist should wear proper gloves, should use the cotton swab to disinfect the proper area. So this all should be maintained. Now something regarding the vein puncture basics. What is vein puncture? It is the process of inserting a needle into a vein to obtain a blood sample. That means it's an invasive method. Invasive method means in which we insert something into the vein or the blood vessel, and that particular thing comes in connect to the blood. Now, what are the common sites? The antecubital fossa, that is the in the inner elbow, is the preferred site due to prominent accessible vein. Alternative sites include the forearm, back of the hand, and wrist veins. So the main target should be in the inner elbow antecubital fossa. What is the equipment required? Standard equipment includes various gauge needles, vacuum collection tubes with different additive holders, tourniquet, alcohol swab, and gauge. Now, how the patient will be positioned? Sit patient in a comfortable recline position with arm extended. That means the patient should be in total relaxed form. Support arm on a firm surface at the side, slight downward angle, so that with the help of that position, the person can take the blood in a better way with the help of the gravitational pull. Position the arm lower than the heart to increase the venous filling. Use a pillow or cushion to provide additional support if needed. It's occasional. If required, then it is used. For patients with history of fainting, use a fully reclined position so that enough amount of oxygen is circulated to the brain. Next, applying tourniquet and locating the vein. Tourniquet is placed 3 to 4 inches above intended puncture site. What is tourniquet? It's a device which is wrapped on the upper arm so tightly that it occludes the blood circulation for a while, so that the turbulation of the blood is not present there, and for momentum the blood can be collected with proper ease. Palpate the suitable vein that feel bouncy and elastic. Avoid sclerosed, hard or rolling veins. Look for the straight visible veins that don't divert. So from which vein the blood should be collected is a very vital thing. Now, if veins are difficult to locate, try these techniques. Have patient make a fist, gently tap the side. That is the most used one. That is gently tapping the side. Sometimes what happens, there is a layer of the fat which occludes the visibility of the vein or the fillings of the vein. So by gently tapping that particular side, the vein can be filled in much easier way. Now, needle insertion technique. Without needle insertion, I have already told that it's an invasive technique. So, needle insertion is very much required. So, what are the key factors we have to keep in our mind? Number one, select appropriate needle gauge, that is 21 to 23 for a routine draw. So, please keep it in mind, that is 21 to 23 G is the natural appropriate needle selected. Hold the needle at 15 to 30-degree angle to the skin surface. If the angle is less than that, needle point will go within the skin. And if it is more than that, then the needle will go through the vein. So the angle should be between 15 to 30 degree. Next, insert with bevel facing upward in one smooth motion. What is bevel? Bevel is the tip cutout portion of a needle which will draw the blood inside the needle. So the bevel should be always in upward direction. Next, stabilize the vein by pulling skin tough below insertion site. So before collection of the blood, the vein should be pulled a little. Avoid hesitation which increases the patient discomfort. So a phlebotomist should not hesitate to collect the blood, because if the phlebotomist hesitates, then the patient will be much more nervous. Now the blood collection technique. First of all, we have to verify the flow. Once needle is inserted, look for the blood flashback in tubing or tube filling. Means if the blood is not coming within the tube after insertion of the needle, then the positioning of the needle should be altered. Now the collection of the sample. Fill the tubes in the correct order. That is the blood culture, coagulation, serum, heparin, EDTA. That means in which vial the blood should be collected. That depends on the type of the test prescribed by the doctor. Next, to release the tourniquet means before pressing the needle, means pulling the needle out, the tourniquet should be released so that the normal blood circulation is restored. Safety protocols during the blood collection. So number one is PPE, personal protective equipment. Always wear gloves during blood collection procedure. It avoids the contamination. Use lab coats or gowns to protect the clothing. Face shield or mask when splash risk is present. Needle safety. Never recap the needles after use. That means the needle used by one person should not be inserted in the body of other person. Number one, that is very much vital. Number two, the needle should not be kept after use. It should be destroyed by the help of the syringe needle destroyer. Common blood collection method. Two the most common blood collection methods are vein puncture method and capillary puncture method. The vein puncture method, the standard method for collecting larger blood volumes, means 5 to 10 ml. So there are different types of volumetric needles are available, that is 1.5 to 2.5, then 5, 10. So it is better in this case to use the 5 ml needle. Use needles and vacuum tubes or syringe to draw blood from larger veins. Larger veins is suggested from the standpoint of the safety during the blood collection, typically in the antecubital fossa, preferred for most adult patient and comprehensive testing. Capillary puncture, used for the small blood volumes like 0.5 to 1 ml, involves puncturing skin with a lancet to collect the drops of blood from capillaries, ideal for pediatric patient, geriatric patient with fragile veins, and the patient required frequent testing. Next, equipments used in the vein puncture. Needles that is available in 15 to 25 gauge sizes, smaller number is equal to larger diameter. That thing should be in the mind, that smaller the number of the gauge, larger is the diameter. Vacuum tubes color coded based on additives, tube holders where the tube should be kept. Butterfly needles for difficult or small veins, that is very much used in case of the chemotherapy patient. Tourniquet, single use or reusable, alcohol swab to make the site disinfectant, gauze and bandages for the post collection uh, if needed. Managing the nervous patient, that is very much important, because all the people going for giving the blood sample is not steady by mind. So communication technique, the phlebotomist who will collect the blood should be very much calm and very much um, make the patient free. Then a physical comfort measure, ensure the patient in recline position, and the patient in this case the patient should be avoided to see the collection process of blood. Then distraction method, engage the patient in conversation about the topics unrelated to the procedure. Capillary puncture, it was just told that when the amount of the blood is only 0.5 to 1 ml, then in case of the pediatric patient and geriatric patient, then this capillary puncture technique is used with the help of the lancet, which have a fixed uh, uh, size, which will be inserted into the capillary. Capillary blood collection procedure, that is very important and very crucial. Site preparation is very important. Warm the collection site if necessary to increase the blood flow. Most of the time during winter, the skins are very freezy. So at that time, if the capillary blood collection is required, then you have to warm the collection site. That means the tip of the fingers. Then the puncture technique, hold the finger or the heel firmly. So this collection of capillary blood can be done either from the finger or from the heel. Quick puncture is required with the help of the lancet. Collection process, wipe away the first drop of blood because it contains the tissue fluid. And if we collect the blood with the along with the tissue fluid, that will decrease the volume of the blood. Post collection care. It is not required for all the patients, but for most of them it is required. First of all, the tourniquet should be removed, then the needle should be withdrawn gently with activating a safety device, then apply clean gauze with the firm pressure 1 to 2 minutes to stop the bleeding. Check the complete cessation of bleeding before bandaging. Apply adhesive bandage or cohesive wrap. That is always important nowadays to avoid the infection. This is very important. Blood tube additives. Not all the blood tubes are required for the different means single type of test. Like if the cap color of the tube is light blue, then it contains sodium citrate as anticoagulant, which will prevent clotting, and it is used for the coagulation studies like PT, prothrombin time, PTT, like partial thromboplastin time. If the cap color is green, that means it contains heparin as anticoagulant, and it is helpful for plasma chemistry and blood gas. If the tube cap color is purple or lavender, that means it have EDT inside. This is the mostly used vial in the routine laboratory test. It's usually used for CBC, then blood typing, then ESR. Gray colored cap tube, it contains sodium fluoride, which is helpful for the glucose, lactate, and alcohol. Now, how the tube should be moved? so that the blood and the anticoagulant mix thoroughly. For EDTA, 8 to 10 gentle inversion is enough. For citrate 1, 3 to 4 gentle inversion is enough. For heparin, that is the green cap, 8 to 10 gentle inversion. For clot activator, which is a red cap, 5 gentle inversion. Glycolytic inhibitor, that is gray cap, 8 to 10 gentle inversion. Each inversion should be a complete 180-degree turn and back. That should be kept in mind. Storage and transport of blood samples. All the blood samples are not possible to be checked at the moment. So it should be stored well and transported well so that it can be checked afterwards. So temperature maintenance is very much important. Frozen storage minus 20 degrees centigrade is used for long-term preservative of certain analysts. Then transport protocol, use sealed biohazard bag. That is very important, of using sealed biohazard bag, because the phlebotomist don't know what type of sample he or she has been collected and what type of microorganism is present within that sample. Then time consideration, process specimen within recommended timeline like 24 hours refrigeration for chemistry, biochemical analysis. For hematological analysis, 6 hours at room temperature, like that. Common blood test. For hematology test, CBC, complete blood count, then erythrocyte sedimentation rate, ESR, which measures the inflammation, then coagulation profile, which assess the clotting function, means the functional status of the platelet actually. Now, regarding the chemistry test, basic metabolic panel like electrolytes, kidney function, like that, cardiac enzymes like troponin, CMB. Specialized tests are there like thyroid function test, then hemoglobin AI, A1C, then therapeutic drug monitoring and all. Challenges in blood collection. Difficult venous access, that is very, very important. Difficult, difficult venous access. This causes include obesity, dehydration, previous trauma, or frequent vein puncture. Solution: warm the site, use gravity by lowering the arm, try alternative sites like hand veins, or consider butterfly needles for better control. So, if the vein is not found, means if the antecubital fossa is not found properly, then alternatives can be tried out. Next, patient related challenges. Anxiety, needle phobia, syncope means fainting. These are all the problems related with the patient. The phlebotomist have to deal with all these problems with his or her appearance. Technical complications, issues like collapsed veins, then excessive bleeding or sample hemolysis can occur. Hemolysis of the sample should be avoided because once the patient gone, that means the sample is gone with the patient. So the conclusion: best practices in blood collection. What should be kept in mind? Number one, proper patient identification is non-negotiable. That means the sample should contain the ID, the name, the date of birth of the patient, and also the sex of the patient. Next, technique impacts both patient experience and sample quality. Next, follow standard order to draw to prevent additive cross contamination. So contamination should be avoided. For that reason, PPE, then gloves, then cotton swab. These all will be should be used. Adhere to safety protocol to protect yourself and patient. Maintain chain of custody for all specimen. Continue professional development as techniques evolve. One thing must be remembered, that high quality blood collection is the foundation of accurate laboratory result, which directly impacts patient diagnosis and treatment decision. So everything depends on the proper blood collection. So thank you for your patient listening. Like, share and subscribe my channel eduhub.2m to get the notification of the newly uploaded videos. Thank you all folks.